Hello future doctors, how are you all? Welcome back to Medsteps YouTube channel. So now actually we are discussing our physiology in musculoskeletal system. So our topic is, in today's episode we are going to break down of cross bridge cycling and in skeletal muscle, cardiac muscle and smooth muscle, and little amount of things like excitation and contraction coupling in skeletal muscle. Step by step, everything from basic to clinical, everything we are going to cover in this video. Okay, so guys, I'm following the first aid guide, so you can cross check with me and we will study together. Okay, so without time waste, let's start. So before knowing the cross bridge cycling, we have to know the basics of muscle structure. I already discussed in our previous videos in physiology, but I will give little brief. Okay, first of all we are going to discuss about skeletal muscle structure. Here in skeletal muscle is composed of thick filaments like myosin and thin filaments like actin. Okay, so the myosin heads project out and are responsible for forming cross bridges with actin during contraction. Thin filament components like actin, two chains from the helical structures, and we can see tropomyosin. It lies in the groove between the actin filaments and blocks myosin binding sites at rest. Next we can see here troponin. This tropomyosin or troponin complex. In this troponin complex we can see three subunits, that is troponin T, like TNT, it binds to tropomyosin. Next one troponin 1 or troponin I, that means TNI in simple form, it inhibits actin myosin interaction. Next one troponin C, or you can tell in simply TNC, it binds calcium and triggers conformational changes. So why this thing important? What's the clinical importance? Means you can see here this cardiac troponins. This cardiac troponins we can see, especially like troponin I and T, are key biomarkers in myocardial infarction. Okay, so now we are going to see the excitation and contraction coupling. So in this excitation contraction coupling, we can see first of all the person, like before that now working, we have to see the nerve impulse. Okay, when that people getting nerve impulse, then after it, nerve impulse means it triggers action potential in the muscle cell, and then after we can see depolarization, like travels down T tubules. This everything we studied in our previous video, just I am giving brief. Okay, and then after it stimulates sarcoplasmic reticulum to release calcium. Then after calcium will binds to troponin C, and this causes tropomyosin to move, exposing the myosin binding sites and actin. Now the cross bridge cycle begins. Okay, so in cross bridge cycle, first of all we have some 4 key steps of cross bridging cycling. So first one, you can see here in this image, you can see here the first step 1 will be cross bridge formation. That means the myosin head with ADP plus phosphate attached binds to the actin site, binds to the actin site. Okay, then after we can see that step 2, that is power stroke. Here we can see some power stroke, that is the release of ADP plus phosphate, that means myosin head pivots power stroke and actin filament is pulled. Next one step 3. In step 3 we can see detachment. Okay, in step 3 detachment we can see here, in this detachment the ATP binds to the myosin head, it detaches from actin. Okay, so in step 4 we can see recocking, that means ATP is hydrolyzed and myosin head returns to cocked position ready for another cycle. Okay, so this is the step 1, then after step 2, then after detach step 3, then after step 4. Okay, so the cycle is repeats as long as calcium present and ATP is available. Okay, so you can see here in step 1 we can see the calcium released. How? I already explained this thing. First, whenever that muscle have to move, that time nerve impulse will get. Then after the in nerve impulse we can see triggers action potential in the muscle cell. Then after we can see depolarization. The depolarization means it travels down to T tubules. Then after it stimulates sarcoplasmic reticulum to release calcium. Then after calcium binds to troponin C, and this causes tropomyosin to move, exposing the myosin binding sites on actin. So now every time whenever calcium is there, how much calcium it's there and is present, and ATP is also available. Okay, so next we are going to see the smooth muscle. In smooth muscle, I forget to tell about clinical significance. So before knowing clinical significance, you have to know the exact each component and the component function. So you can see here guys, for example myosin function. What myosin will do means it will binds to actin, then after it drives contraction. Okay, this is the main function of myosin. Next one, if you are seeing the actin function, the actin has help for myosin binding sites. Next we can see tropomyosin. The tropomyosin will blocks binding sites at rest. And we can see next one troponin. Next one troponin C. In troponin C, the function will be like it binds calcium to initiate contraction. Okay, next one ATP. In ATP we can see it detaches myosin and it energizes head for next cycle. Okay, so this is the components and that main function. So in clinically why these things important means, here I forget to mention these things. So in clinically we can see one thing, that is rigor mortis. So what is rigor mortis? After death, that in human body, in muscle tissue we can't see any ATP production. So the calcium will leaks from sarcoplasmic reticulum and it binds to troponin C, and it the cross bridges will form, but without ATP the myosin cannot detach, then muscles become fixed and stiff. Okay, so this is this condition is known as rigor mortis. So the enzymes from lysosomes is gradually break down proteins and muscle will get relaxed. Okay, so after that mostly people will get stiff. Why? Because of this thing, because of no ATP. Okay, so these are the main things. Next one, in cardiac muscle, like it's in cardiac muscle also it's like similar, like cross bridge cycling same to same it will occur like that. Troponin I and T are released into the bloodstream when cardiac muscle is damaged, like myocardial infarction. That's why that time we can do, if any patient got MI, automatically we are going to check troponin test, right? In troponin I is the most specific marker for cardiac injury and remains like elevated for 7 to 10 days. Okay, so that's why this is very important. Next one, how we can manage these things means, mostly we don't treat this cross bridge cycling directly, but we have to understand it is essential for managing muscle disorders like myopathies, or myasthenia gravis or rhabdomyolysis. These are the things it will help to treat, or it will help to understand. Using neuromuscular blockers in anesthesia, and we can evaluate troponin levels in acute coronary syndrome. Okay, so these are the things main important. So next we are going to discuss about smooth muscle. In the smooth muscle, we can see here smooth muscle contraction. Mostly this smooth muscle we can see mostly found in the walls of blood vessels, and bronchi, GI tract, uterus and bladder. This smooth muscle is mainly it's like involuntary and non-striated muscle. We can see contraction is initiated not by troponin but by phosphorylation of myosin. So we can now we are going to see the step by step of smooth muscle contraction. First of all, you can see this image, you can see here in this image you can see calcium influx. The calcium came into the endothelial cells. So the calcium influx you can see, that means it's like depolarization or agonists, example like acetylcholine, bradykinin. Okay, it open ligand type voltage gated calcium channels. The calcium enters the smooth muscle cell. Then after we can see calmodulin activation. This calmodulin activation means, in CA means calmodulin activation, you can easily remember this thing. That means myosin activation process, also known as calmodulin activation. Here what will happen, the calcium will binds to calmodium and it forms calcium calmodium complex. What it will form? Calcium calmodium complex. You can see here, this is the calcium calmodium complex. Okay, then after we can see the myosin light chain kinase, or we can tell MLCK, myosin light chain kinase activation. So here the calcium calmodulin activates and the myosin light chain kinase we can see, and this myosin light chain kinase phosphorylates this myosin light chain, it activates myosin. Okay, next one, cross bridge formation. How it will form cross bridge formation means, it activated myosin binds to actin, contraction occurs. Okay, so this is the contraction process. Now we are going to see the relaxation process in smooth muscle cells or smooth muscle. So myosin light chain phosphate, this one myosin light chain phosphate or MLCP, it's like dephosphorylates and MLC terminating contractions. This is how smooth muscle relaxes. Okay, so next we can see here nitric oxide also doing relaxation. How this nitric oxide will do relaxation means, in endothelial cells. Endothelial cells produce nitric oxide, like it agonists like bradykinin, acetylcholine, and it's bind to receptor on endothelial cells. It activates no synthetase or no synthase, which converts L-arginine and nitric, we can see nitric oxide also. No diffuses into smooth muscle, no activates guanylate cyclase, increases cyclic GMP, you can see here. So the cyclic GMP, guanosine monophosphate, activates MLCP, that means myosin light chain phosphatase, then it will leads to relaxation. So clinically importance will be like the drugs like nitroglycerin, okay, and another drug what, it will do vasodilatation, sildenafil. It enhances this pathway to relax blood vessels, and it reduces blood pressure or treat erectile dysfunction. Okay. So next we are going to discuss about excitation contraction coupling in skeletal muscle. So most commonly the skeletal muscle contraction starts with an action potential from the motor neuron. So, this leads to a series of events that release calcium into the cytoplasm and it activates cross bridging cycling, cross bridge cycling. Okay. So, first of all, now we are going to see the step by step of excitation contraction coupling. Yeah, you can see this image, it is very good image. So, you can easily appreciate, or you can easily understand. First one, action potential. This is now. In now we can see action potential generation. Here the motor neuron releasing some acetylcholine at the neuromuscular junction. This is the first point. This generates an action potential on sarcolemma. Okay. So, when it is coming to second step, in this second step, this is the synaptic cleft from here, because when calcium going to influx, then after that calcium will push the acetylcholine vesicles. Then after in synaptic cleft, the acetylcholine will, we can see in neuromuscular junction. In step 2, the propagation into like T tubules, that means the action potential will travels down to T tubules. So, this is the T tubule. Okay. Here you can see this is the T tubules, this is the T tubule. So, what happening here, the action potential is travels down to T tubule, which are invaginations of sarcolemma. Okay. Next we can see activation of DHB, that means dihydropyridine receptors. Here in T tubules we have some like L type channels, L type ligand type voltage gated calcium channels known as dihydropyridine receptors. In skeletal muscle, this dihydropyridine receptors do not allow to calcium influx. It will not allow to calcium influx. Instead, they it mechanically activate the ryanodine receptors on the sarcoplasmic reticulum. Okay. So, what will happen here? Then after when it is going to then after when the ryanodine receptors got activate, the from sarcoplasmic reticulum we can see some calcium will get released. See here that this is the ryanodine receptors, from ryanodine receptor the calcium is going out. So, calcium will release and ryanodine this ryanodine receptors opens and calcium is released from the terminal cisterna of the sarcoplasmic reticulum into the cytosol. And we can see some contraction in cross bridge cycling. The calcium will binds to troponin C and it shifts tropomyosin and it exposes actin sites. Then after we can see myosin binds, then after we can see power stroke and contraction. This everything we studied in cross bridging. Okay. Now relaxation phase. The calcium here in relaxation phase we can see the calcium removal is essential for relaxation. So, two major pumps removes cytoplasmic calcium. How? First one, smooth endoplasmic reticulum calcium ATPase, that means that it pumps calcium back into the sarcoplasmic reticulum using ATP. Next one, NCX means sodium calcium exchanger. It pumps calcium out of this cell in exchange for 3 sodium in and 2 potassium out. So, in passively uses of sodium gradient. Okay. So, here only in for like USMLE examination and for like NEET PG, FMGE, this thing very important that in physiology, that is sarcoplasmic endoplasmic reticulum calcium ATPase is active transport and sodium calcium exchanger will be like secondary active using sodium gradient. Okay. So, how you can regulate this calcium? In skeletal muscle, you can see the calcium source will be sarcoplasmic reticulum, the calcium sensor will be like troponin C, the contraction mechanism will be like cross bridge cycling via tropomyosin, In smooth muscle we can see extracellular extracellular and with sarcoplasmic reticulum. In smooth muscle the calcium sensor will be like a calmodulin. Contraction mechanism means MLCK mediated myosin phosphorylation. Okay. So clinically what are the things important in today's topic means we are going to use some drugs. It targets calcium, that means calcium channel blockers, ligand type calcium channels, example like verapamil, diltiazem. It relaxes smooth muscle and lower blood pressure. In skeletal muscle does not depend on extracellular calcium for contraction, like it's like different differentiators. Okay. Next, now we are going to discuss about clinical relevance. What are the things important clinically in our clinical rotation? That are the topics we are going to discuss now. The smooth muscle related, first one nitric oxide pathway drugs. So first one nitroglycerin. Nitroglycerin mostly we are using for treat angina by relaxing vascular smooth muscles. Sildenafil is like also known as Viagra. It enhances cyclic guanosine monophosphate by inhibiting PDE prostaglandin E5 and it's like prolonging smooth muscle relaxation. And we can see like calcium channel blockers, amlodipine and verapamil. It reduces smooth muscle contraction in hypertension. Skeletal muscle related like malignant hyperthermia, we have some due to mutation of ryanodine receptor 1. We can see more amount of excess calcium release. So we can see one drug that is dantrolene. Dantrolene is treatment for blocking ryanodine receptor 1. Okay. So these are the things. So next will be like skeletal muscle contract. Next, this everything we discussed about skeletal muscle and excitation contraction coupling in skeletal muscle. Then after so guys, now I am going to give one like small recap for everything. The skeletal muscle contraction from nerve impulse to muscle movement. Motor neuron will be like the neuromuscular transmission. You can see here, this is why I am always focusing this thing, I am repeating means these are the, from this topic most commonly faculties can take questions, and this is very favorite topic for and it's very important topic also in musculoskeletal system. That's why I am focusing here. So I am just giving recap. Neuromuscular transmission, here motor neuron will be like it initiates the signal, and we can see neuromuscular junction, that is the synapse between the motor neuron and muscle fiber. Acetylcholine means neurotransmitter facilitates signal transmission. How this process will happens means the action potential arrival. An action potential travels down the motor neuron to the neuromuscular junction. So this is the neuromuscular junction. Okay. Then after we can see acetylcholine release like voltage gated calcium channels open, allowing calcium influx and prompting synaptic vesicles to release acetylcholine into the synaptic cleft. And we can see some muscle fiber depolarization. Acetylcholine binds to nicotinic receptors on the motor end plate, leading to sodium influx and depolarization of the muscle fiber membrane. So we can see like excitation contraction coupling, like T tubules in T tubules, like it's like you can see here, these are the things is T tubules. In T tubules you can see it's like invaginations of the sarcolemma that transmit the action potential into the muscle fibers interior and muscle fibers interior. Next one we can see sarcoplasmic reticulum, that means here in sarcoplasmic reticulum the calcium ions will store. Next, this dihydropyridine receptors will be like it's like voltage sensitive receptors on T tubules, and these are the ryanodine receptors, calcium release channels on the sarcoplasmic reticulum. How this process will be in action potential propagation, that means that the depolarization wave travels along the sarcolemma and down the T tubules, and we can see here DHPR activation, voltage channel voltage change activates DHPRs, which mechanically interact with the ryanodine receptor 1 receptors. Next one, calcium release, ryanodine receptor 1 channels open, releasing calcium from the sarcoplasmic reticulum into the cytosol. So these are the excitation-contraction coupling in skeletal muscle. Okay. So next one, so why this thing important? If you have any doubts, you can ask me in comment section, because I almost like totally completed about physiology of musculoskeletal system. Okay. So I am not at all discussing about only physiology and some little basic content of clinical significance also, and clinical case, and what are the importance, and in clinical notation, while doing clinical notation, what are the things the doctor can ask. This everything based on my what are the things I am seeing in my hospital, everything I am going to discuss in this series. Okay. So if this video is helpful for you, like, share and subscribe. If you have any doubts, you can ask me in comment section. So we will meet in our next video. Until that time, take care. Bye bye. Have a nice day.